Australia, the world's 6th largest country by size, has been inhabited by Indigenous Australians for over 40,000 years. Since its settlement as a British prison a little over 200 years ago, Australia has developed a liberal democratic political system. Today, Australia boasts the world's 12th largest economy, the 5th highest per capita income, and the 2nd highest Human Development Index ranking, which means it's considered to be amongst the world's most equal societies. Why then do Australia's first people have amongst the highest rates of a preventable disease in the world?
When you look at the statistics around Indigenous health in Australia and New Zealand and Pacific Islands as well, it condemns these communities, it condemns the governments of these countries, that the minority people in those countries, the first peoples of those countries, still suffer so horrifically when it comes to healthcare. And rheumatic heart disease is an extraordinary example of this.
Rheumatic fever, rheumatic heart disease is a disease of the disadvantaged population, and in Australia rheumatic fever and rheumatic heart disease have been essentially eradicated from the non-Indigenous population, and this disease is very specific to our Indigenous population within Australia. Most patients who have rheumatic fever and rheumatic heart disease, they live in very remote and isolated locations, and rheumatic fever just doesn't make the headlines in Australia. It's really a disease that we should be able to prevent, yet it's still here with us.
Here was a disease that was fairly widespread in the mainstream community across most populations, and now it is prevalent primarily amongst these small minority Indigenous populations in this community. So it tells you that people haven't had the awareness, they haven't had the education, they haven't had the access to healthcare to prevent what are entirely preventable diseases. You know, you put this in the same basket of diseases like polio, which were once very commonplace and have now been eradicated, except once again in Indigenous communities.
For the whole of the first half of last century, rheumatic fever and rheumatic heart disease was well recognised by all families throughout Australia. They all knew someone or someone's kid who'd had rheumatic fever, rheumatic heart disease. It was, with many other illnesses of childhood, a part of life in Australia and indeed the whole world. The fact that that doesn't happen in those parts of Australia still has nothing to do with programs around rheumatic fever, rheumatic heart disease. It has all to do with socioeconomic development and housing and a whole lot of other parameters in that area.
So you have a problem of education, you have a problem of access, you have a problem of remoteness, you have a problem of not having the right resources, not enough money spent, not enough people who are bringing awareness and taking the medical practices to the communities themselves. So this is an enormous challenge.
To close the gap, healthcare will need to be delivered to at-risk children, adolescents and young people where and when they need it. Social housing conditions will have to be improved to reduce overcrowding, and education programs designed to improve understanding of the disease will have to be deployed.
Complex situation in remote Indigenous communities is how can people in those communities have the benefits of socioeconomic development, the housing, and also the economic development side, while also being able to have strong culture and also have their links to traditional practices such as hunting and bush medicines, bush food, which is something that is so absolutely intrinsic to their traditional culture, but also living in circumstances where there isn't poverty, where there's good education. Of course that's attainable, and I do think that when you look at some of the initiatives in the arts, for instance, and you go out to some of the remote communities and look at their art centres and the ecotourism being run and directed by Indigenous people, not so much non-Indigenous people, that's an enormous economic benefit to those Indigenous families who are part of that. So potentially you could have a whole connection of remote Indigenous communities where they're thriving with a number of economic initiatives that are making them independent financially and living in circumstances where they literally have the best of both worlds.
Clearly, we have a problem in this part of the world. The lives of thousands of young people are threatened. But there's also a solution. This disease is entirely preventable. So whose problem is this to solve? Those most at risk? Those in their community? Those in the health service? Those in the public service? Those in the lab? Those in power? Ultimately, if we want to close the gap and authentically lay claim to an equal society, then we must view this as everyone's problem.